I've been a physical therapist for over 30 years. I've specialized in the treatment of sacroiliac joint dysfunction over the last 25 years. I've worked with multiple physicians, orthopedic physicians, spine surgeons, and pain doctors who recognize the SI joint as a pain generator. Show me where your pain is. SI joint dysfunction is a very common cause of low back pain. And in a very famous study, it was documented that about 22.5% of patients with low back pain either have SI joint dysfunction as their primary or in conjunction with other pathologies as their pain generator. SI joint dysfunction is difficult to diagnose by conventional means. It doesn't show up on x-rays or MRIs. The only real objective way that you can diagnose an SI joint dysfunction is by a diagnostic SI injection. The other way that I look at the SI joint is by symmetry test, provocative testing, and by motion test. Holly, we're going to do a test on your SI joint. It's a provocative test to see if we can provoke pain in the SI joint. So what I'd like for you to do is to cross this ankle here over this knee, and I'm going to put pressure on the hip bone, or the ASIS, on the opposite side. I am going to put my hand here on the femur and press downward. Do you feel any pain in the SI joint on the left?
Yes.
It's a positive result if you have pain on the left side. This is the compression test. I'm going to put my hands on the outside of the ilii, and I'm going to compress forward and medially. Do you feel pain with this?
Yes.
Which side?
On the left.
That's a positive left test. We're going to do the distraction test now. I'm going to place my hands on the ASIS here on the top of the ilii, and I'm going to press laterally and posteriorly. Do you feel pain with that?
Yes.
Which side?
On the left.
That's a positive test for the left. We're going to do the Genslin's test now. So I'd like for you to slide over to the edge of the table and very gently drop this leg off the table, the right leg off. We're testing the left side. I'm going to flex this leg up, and then I'm just going to press downward, and I want you to tell me if you feel pain in the left joint. Any pain there?
A little bit.
Okay, that's a positive test for the left. You can slide back onto the table now. Let's do the other side. Slide this way. We're going to drop this leg off the table. I'm going to raise this with the knee and the hip bent to 90 degrees. Apply an overpressure. Do you feel pain in the right SI joint?
No.
Okay. That's a negative test. We're going to do the thigh thrust test now. So I'm going to place one hand right under the ilium over the SI joint. I'm going to bring this hip and knee up to a 90-degree angle. I'm going to place one hand on the femur, and I'm going to thrust posteriorly. Do you feel pain?
Yes.
Okay, that's a positive test on the left side.